Thanks, everyone. Welcome to CNHED's PPE and Public Health Training. Today, Wednesday, September 30th. We are looking forward to digging into this topic. We are joined by some wonderful guests, experts in the field, in partnership with the Ward 8 Health Council and Bridgepoint Healthcare, as well as DC Health. We will begin our presentation.
Hello and good morning. You're going to read us the questions, or should I start now? You let me know.
Yes, I'm just going to give folks a couple housekeeping notes. We just want you to remain on mute as we go through our presentation. Also, questions were submitted in advance of today's presentation. Those will be answered by the panel. And any additional questions today can be asked via the chat box or the Q&A function that you have on your screen. And finally, just to let you know, this webinar is being recorded and will be shared with participants after the event. Today's guests, we are featured from DC Health. We have Dr. Kimberly Sommers, who will be joining us. Dr. Sommers is an expert in the field. She obtained her undergraduate degree from The Ohio State University in 2002. She graduated from Ohio State College of Medicine in 2006 and completed her internal medicine residency at Riverside Methodist Hospital in Columbus, Ohio in 2009. Dr. Sommers has worked in various settings around the US, practicing medicine and clinical infectious disease, and most recently spent 3 years in private practice in New Orleans, where she took care of COVID patients when the epidemic first hit. Since May of this year, Dr. Sommers has been at DC Health on the COVID-19 response team, leading the guidance and policy team. And we also have Ivani Ortiz Torres, MPH, joining us from Puerto Rico kindly today. Mr. Torres has over 20 years of experience with the DC Department of Health. He is the former interim head of the HIV/AIDS Administration and currently serving as Language Access Coordinator at the Office of the Director. And so with that, we will turn it over to our guests.
Thank you. Thank you so much. We're really, really glad to be here. And I should start by saying greetings from the beautiful island of Puerto Rico. It's almost like a commercial. Although I'm here, not exactly on vacation, but taking care of mom who lives here. I am glad to be here and to be joined by Dr. Sommers shortly. We're having, as you saw, some technical problems. She is an amazing doctor that has a curriculum that it's like, I still don't know how we were able to get Dr. Sommers that quick because she's just a hit in terms of a get for the Department of Health and for the District of Columbia. As Ms. Rideout said, my name is Ivani Torres, and I have been in DC for the longest time. Sometimes I feel like I got there with the Roosevelts. And I'm there because we share a common wish, a common inner feeling, more than just action alone, to better the quality of health, the quality of life of all residents, including health. Anyone can say thank you to a group that invites us to talk or share thoughts. But in your case, Ms. Rideout, I give you kudos by the way that you have been able to organize the things that are being done by CNHED. You epitomize what a partner should be. Honestly, I mean this from the heart, and I say this on behalf of our director, Dr. LaQuandra Nesbitt, because when we discuss this, one of the things is like, who are they and what are they doing? And she knew about it, and she knew that this is all about behavior modification and harm reduction. This is really, really what you are doing is really about bringing health equity, badly needed health equity to the residents of the District of Columbia. This is a concept that for some people is new, for some it's something that it's older, but it's it should be kind of a guiding light for all of us, no matter where we are. in your case, in issues related more to housing. So I commend you for what you're doing and for being here. We are kindly, very, very humbled by you reaching out to the department and to discuss. I'm going to start very quickly by doing the basics, and I'll tell you why. I don't want you to be insulted, in terms of us oversimplifying or the issues that are at hand. I'm gonna remind this because it's I'm gonna make references to the website, to the coronavirus.dc.gov, coronavirus.dc.gov. And in coronavirus.dc.gov, you are going to see that one thing that I should say about that website, it is constantly updated daily. It's updated on a daily basis. It's chock full of information, and the data that you will see there is the same data that the mayor got that morning. So we get it at night. It's crunched and processed. The director gets it, so you can see the process at 7 in the morning. The mayor gets it at 8:30 in the morning, and the public gets it at 11 in the morning. So that will give you an idea of what is the cycle of information collection and updating, including phases, including the trials, how many people are tested, the positivity rate, things that we're going to talk briefly about shortly. But I wanted to make reference to that is a great source of information. We're having this wonderful conversation today, but this is today. We hopefully will have many more. But you can, on a daily basis, go to coronavirus.dc.gov and be able to retrieve information, updated information. And I'll start with the 5 elements that are so important. And I'll tell you why I start with the basic. Practice social distancing, the 6 feet, 2 meters. Remember that all of us speak or talk, understand the English system. It's me, even as a Puerto Rican, yes, because of the relationship with the United States since 1898, we use the English system. So we say 6 feet. But a lot of people, almost the rest of the world, except us and the UK and nations that were part of the British Empire, they use the metric system, which is basically 1.5 meters, 2 meters is that social distancing that we have of 6 feet. So why do I say that? Because we need to constantly remind that. Imagine that we put up signs, and those signs are in the website for them to be downloaded, that basically reminds everyone in every public area, circulation, in an elevator, in a lobby, that says the 5 do's, practice social distancing, wear a mask or face covering, science is science is science, wash your hands for 20 seconds or more, stay home if you are sick, and get tested. I know it's basic. I know this is September and not April, but what happens is that some people still don't get this. So I am kindly imploring you to do everything that you can to remind people of these basic ones. Some people knew then and they forgot. So this is a good opportunity to remind, and signs that do reflect those are in the website, and it looks like this. I'm even going to show it. I don't know if it's going to be able to be seen, but it's going to look like this. And the website, you'll see how easy it is to navigate. And then a sign like this is wonderful if we are able to display it in any areas. I have symptoms, what should I do? And I know it sounds simple, but a lot of people do need that information. We're going to address the questions, but I have something else that we need to share with you. The District of Columbia has done marvels. And I say this not as a part of the Department of Health. I say this as a long-term resident of over 25 years. You have seen difficulties. I'm not going to use bad adjectives. I'm going to say difficulties that look unsurmountable in other jurisdictions, in other states, in other cities. And that has not been the case. We prepare for the worst, and we didn't get the worst then. You remember when the convention center was going to be a major hospital, when we were thinking of overflow in the intensive care units and others. We never know what tomorrow, will bring us, but we must be prepared as if the worst is coming. And we did. And tremendous progress has been made, but there is still a lot to do. if in that same website, coronavirus.dc.gov, you will see information that still shows what we call the hotspots. It's a term that it's used, but really I call them the Gordian knots of the epidemiology. Some of them have been very difficult to solve. One of the neighborhoods, and I'm quoting again from the website, and we are avoiding, just saying it's about this or it's about them or those, because this is not about the stigmatization of anyone or any area. But in that data that is presented in the website, you will see that Upper 16th Street Northwest is the #1 hotspot, if we can use again that term. The #2 is Columbia Heights, the area of Columbia Heights. If you're familiar with the city, you know that those two are in the upper northwest part of the city. I see Dr. Sommers coming in to the rescue. I see the cavalry. So in those two areas, we still have problems, but there are others. And in the website, you'll see #1, Upper 16th, #2, the Columbia Heights, and then at the very bottom, you will see the area of GW, Georgetown, and many other areas with very few cases. Although they are, deep ingrained, reasons for many of them, and we're going to talk about health disparities, about access to care, affordability, meaningful employment. They're all areas that we have to consider when we are looking for the long-term solution. But we're in a crisis. So what we do now is concentrate on, like you said, like Ms. Rideout very, very, very clearly and very aptly said, we want to talk about harm reduction, and we want to talk about behavior modification. And your role in this is very, very, very important. So I say to you, check those resources. There is a list that you can go, and I took these screenshots of the website, so you could see, that there are resources that you can, hyperlinks that you can click. They are in other languages in case you want to have, resources to print in other languages. But they go from business and nonprofit resources to childcare resources, healthcare providers, and some of them, like you click on it and something like this will come up. I'm showing the screenshot so you can see how easily it can be seen, read, and downloaded, printed, and how it covers all rental assistance programs, housing assistance program, the DHCD rental assistance program, which is a local one, the emergency rental assistance program, ERAP. I'm familiar with those. HPP program, which is for homelessness. DCMAP, that's the mortgage assistance program under COVID-19 specifically, and the mortgage resources and information. So you will see that, and then you will see things that you might find interesting, important, not only for you, but to share with those, of your clients, like the guidance on for persons who tested positive for COVID-19. And things like that are downloaded. This is only a 2-page document that can even be reshaped into a page and a half, like I did here. And would be great items for us to share with our customers and our clients. Now, what I'm going to do is 2 things. Obviously, I'm going to allow Dr. Sommers to, come on board. We're going to, she's going to give us some information, and then we're going to jump right in to your questions that you have submitted and that we want to address, and that we're all very, very valid. I was like super impressed, because I was like, this group is like, I'm talking to a group of healthcare professionals that, know what to ask and how important it is. So thank you for submitting those questions ahead of time. And I promise that both Dr. Sommers and myself will address them shortly. So now the Puerto Rican in Puerto Rico is going to stop talking, and you're going to hear a wonderful, as I told you, one of the best guests that the Department of Health could get in 2020, which is Dr. Sommers. Dr. Sommers, come ahead and join us. And nobody can have an idea of trying to lure Dr. Sommers away, because I will never allow that. Go ahead.
Can you hear me? Can you hear me now?
Now we can. Now
Okay.
we can. Yes.
I apologize for the technological problems. I think we don't use Zoom as much here, so I was not the best at that. But I've been on, I swear I heard everything since 11 o'clock We've been listening to Ivan down there in Puerto Rico. So Ivan, would you like me to just talk about some basics, or would you like
Yes,
me to?
yes, if we can go, yeah, through the
Yeah.
quickly, because they are very familiar, yes.
Okay.
And I think we have like 35 minutes left. Yes.
Okay. So you kind of talked about the core principles of prevention of COVID, right? You've already kind of gone over that, right?
Yes.
So just to quickly touch on that, some of the most important points, we have 4 core principles that we are useful for pretty much everyone across society and are really our most powerful tools, which are not fancy at all, but they're very, very powerful for preventing COVID and spread of COVID, which are staying home if you're sick. We want to always do that, and we want employers to have very generous policies about taking off.
I think we lost audio.
Can't hear me? What's that?
No, we cannot hear you.
You can't hear.
Yes.
All right. Oh, what is it now? Let me see.
I can hear you, Kimberly.
Oh, you can hear? All right, good. All right, so staying home when you're sick, social distancing of at least staying at least 6 feet away from people who are not from your household, wearing cloth face coverings or masks and wearing them correctly, and also hand hygiene. Those are the 4 fundamental principles that we just always want to repeat and repeat that are really key to getting control of the pandemic. So at residence communities, apartments, buildings, some of the really important other things to remember are, well, the main thing that everyone who works there would need to focus on is mainly wearing a cloth face covering or mask, which is not PPE. And so that's, under most circumstances, that's all you need, since you're not healthcare workers. So the only situation in which you would want to go for more PPE, what we call PPE, which is gowns, gloves, eye protection, or respirators, that would be in a circumstance in which you'd actually be around a person who had COVID. Like if you had to, for an emergency, say someone's apartment's flooding, that would be the only circumstance where you'd want to put yourself at that kind of risk. And you'd need to make sure the staff is trained and knows the proper PPE to wear in that circumstance. So I want to emphasize that it's very important to avoid going into any person's space or residence who is ill. And again, if they're ill, it could be COVID, because almost anything can be a symptom of COVID. And you're not a doctor, you're not going to make the diagnosis or be expected to know if someone has COVID or not. But if someone's even ill, I would avoid at all possible sending any workers into that space, because that's just you don't want to put yourself at risk. So in addition to screening employees daily with a screening questionnaire to see if they are sick, if they answer yes to any screening questions, either in person or over the phone, I would also recommend, if a person calls for, say, a maintenance call, repair call, screen that person. And then if that person or anyone in that home at the present time is sick, do not do that service call. Try to postpone that until that person is better. And only if it's a real emergency. Obviously, some situations are emergencies that need to be addressed, but hopefully that would be in the minority of times. You really want to keep the workers away, and that would be an important way to keep them safe.
Awesome.
Let's see. Some other things in our guidance that are relevant to you would be pools. So probably by now you all know about the policies for pools, but I'll just review some of it. So pools, there's different, depending on what setting you are in DC, pools can be open or pools cannot be open. So public pools right now are not open, but we are allowing pools that private residences or private residence communities, such as apartment complexes, to be open, as well as pools and gym. Now, pools and gyms are allowed to be open only for lane swimming, or lessons. But in a place such as yours, the pools can be open, but there's a lot of rules. It's important to restrict access to that pool to residents only. You wouldn't want to allow members of the community or their friends to be using that pool. And, all right. Want to start taking some questions or?
Yeah, we can probably do that so we don't,
Yeah.
miss any of the questions that we have. Is Miss Rideout is fine? Can we address them as you send them to us?
Absolutely.
Great.
Yeah.
Okay, so Doctora, the first question that we have is from Ms. McJunkins, and it talks about, addresses the issue of return to work. Can we talk a little bit about the return to work best practices or protocols after an employee is exposed or test positive? Some of what you just mentioned, and I was like amazed because I never thought of, for example, the service or repair people.
Yeah.
I never thought, when you were talking, I was like, oh my God, that's true. That's something. So the question is about returning to work, the best practices after the employee is exposed or test positive.
Okay, well, I can give basic answer to this, but
Yes.
it's good to know that there are very comprehensive, detailed guidances that we have on this very subject. 2 different ones, in fact. We have, if you go to coronavirus.dc.gov, we have guidance for people who tested positive, which goes into, and then we have guidance for people who were close contacts of people who tested positive. So it walks you, step by step of how you should proceed. So in general, very generally speaking, this could be a complicated question depending on, there's a lot of subtleties to it. But in general, if you've been diagnosed with COVID, you are considered to be infectious, or you're allowed to kind of leave your isolation and start to resume normal activities. In general, it's 10 days after your symptoms first started. 10 days have to have passed. You have to be fever-free without the use of Tylenol or Motrin or something. Mm-hmm. And you also have to feel better, so you also have to feel recovered. And for some people, I say it's a little bit of a subtlety to this question. So 10 days is the all-purpose answer. But for some people who may be immunocompromised, it can be up to 20 days that we tell them to wait before resuming their normal activities. And in that case, obviously for everyone, we recommend that this all be done under the care and advice of your physician, not just you making that determination. So if at all possible, these decisions are best made and tailored for you by your own personal physician who knows your health, your whole health picture.
Perfect. Thank you, Doctor. We have also a question that is about what are some of the best practices while sharing office equipment? That's a good one because, we can all be negative as of now, but we're sharing equipment. It can be the printer, it can be, a camera, even a laptop computer. Any best practice? Yes.
So it is a good question. Any kind of shared, all right, so as much as possible, a good thing to say is to avoid shared item use as much as possible. Obviously that, it wouldn't be practical to do that for everything, but as far as possible, have people use their own things. Don't go touching the stapler or grabbing the stapler off another coworker's desk or something. Use your own things and touch other people's stuff as little as you can. If there is shared equipment, because there's gonna be sometimes, then that actually the employer is responsible for making sure that stuff is cleaned. Shared items are cleaned between use by people. So that can be challenging. So that's why it's better to try to use other people's things and not have shared items as much as possible.
That's very good. My personal experience in the fifth floor of the Department of Health and the Office of the Director is that we're doing almost all printing, from our own stations, avoiding, making the copies right there in front of the copier. That we have hand sanitizer right next to the copier, because if you're going to touch it in any way, you have to clean them and then clean them. So it's like a process going to the copier, which is the thing that we share the most. We also have a fax item, and we have another one there. And we try to avoid printing unless we just print and you pick the copies and that's it. If you're going to scan, I do recommend, because over there you're going to use it right there to scan, make sure that you have hand sanitizer next to those shared items. And we also, like the doctor mentioned, we put away all the things that are next to the copier, like the stapler and the stapler remover and all that was put all away. So if we're going to use that, we have to use our own. And that's basically, one thing that we did in the office of the director. There is another question that says, what is the proper mask to wear? This is the $64,000 question, because it doesn't have, like an answer. It has many answers, but it all depends. And I know the doctor is going to mention that she has thorough experience with that. What areas should have hand sanitizer in the office? I think we kind of covered that. I would add that we also have it at the entrance. Every time we enter the office, the fifth floor, we, clean our hands. And when we leave, we clean our hands. No people with gloves inside. Because if you just bring your glove from outside and you have been touching all over surfaces that might have the virus, you're bringing them inside the office because you're using the gloves, and you might be okay, but we are not okay if we don't have the gloves. So that is another thing that we don't have. So the question is, what is the proper mask to wear? And are the face shields better than the mask? No one else is better qualified than the doctor to answer that one.
Well, yeah, I'm happy to answer this one. So for the general public, i.e. non-healthcare workers, people who are not, having close contact with ill people, the proper face covering, is either a cloth face covering or the like, which, there's a lot of those out there now, because a lot of people like do it yourself or buy them from all kinds of sources. So they're pretty unstandardized. So either face covering, cloth face covering, or a surgical mask is appropriate to be worn by the public. So it's also important to make sure you're wearing your mask correctly, or cloth face covering, which means covering your nose and having your nose and your mouth covered. Yeah, Ivan's going to demonstrate. If it has a little metallic thing at the nose, you just sort of mold it to fit. You don't tempt it, like poke it into a point, because that's kind of like bird beak. You don't want to do that. You just kind of want to mold it gently so it fits your nose. And you're going to want to make sure it fits snugly around your face. And the best cloth face coverings are actually, and most breathable, that you can breathe through and that have good ventilation, would be like a double layer of cloth. That would be one of the types most recommended. So we talked about hand sanitizer, you said already. And are the face shields better than the mask? Okay, there's a misconception out there that a face shield is a substitute for a mask. And so I want to make it clear that a face shield is never a substitute for a mask. Just think about what's going on. Your nose and your mouth are kind of just, the air is flowing right out, under them. So it doesn't provide what we call source control, which is the whole point of covering your face, the respiratory protection. And source control means you're keeping any particles and germs that you might exhale or cough out contained, and the face shield's not going to do that. The face shield they'll just come right out still. So face shield has a very specific use, and face shields are considered eye protection, okay? Which the general public does not usually need to be concerned with having eye protection. Eye protection is meant to prevent against splashes and sprays. So as far as there might be some individuals, such as cleaning personnel, who might need to wear eye protection as a routine part of their job. But I'm talking about COVID, and you never want to wear a face shield as instead of a face mask. So Don't worry about the eye shields. Wear a surgical mask or a cloth face covering.
Perfect. How long is a disposable mask safe to wear during a shift? And
Okay.
does the effectiveness of the mask decline once it is damp?
Okay, also good question. So disposable mask, I would, as a general rule of thumb, change it every day. Or if you have, as far as like the disposable ones, throw that out after at the end of the day, at the end of the workday, and get a fresh one the next day. And the cloth face coverings, I would probably try to have a few of those because they're reusable. And I would put it in the laundry at the end of the day and get a fresh one. So always start the day with a fresh one. Other times to change it are if it gets, this relates to wet. If it's wet, you need to change it. It's not effective if it's wet. And so don't go in the pool with it anyway. But, so if it's wet, you change it. If it gets visibly soiled, like, you know, some food splashes or your, you know, your lunch, some of your sauce from your lunch gets on it, or blood or any kind of soiling where you can see that it's soiled, then that's the time you need to change it too. Don't walk around with a damaged or, you know, ripped, soiled, or just dirty mask.
Very good, very good. I clean mine every night, and I have several. So once it's clean, you know, it stays there. I wash it, hand wash it. It's really quick. Then I wash my hands right after that because I've been in contact with it. Lots of soap, you know, lots of water to get the soap out. You put it, you hang it, and next day it's going to be ready. But if you have more, then, you know, it's even better. Now, the next question is very procedural, very important too, you know, on how can we help our clients, their clients, of which are our clients too, to how are we going to be able to, for them to gain access to the information, to this information that we have, and information that is more, and share it with friends, family, and others. And I can venture to tell you what I said in the beginning. Coronavirus.dc.gov has amazing sources of information. It has English information, but it has also Spanish information, Amharic information, French, Chinese, Korean, and Vietnamese. So all that information, because you might have clients, you might have customers that do engage in those languages. Remember, there is something called the non-English proficient customer, and there is the limited English proficient customer. The non-English will not understand anything except hello. The limited English will understand some basic commands and will say, okay, do this, don't do that, be careful. But once you go into behavior modification, into risk reduction, you might want to reach out to that person or that group of persons in their native language. And those resources are available. Now, I'm going to do something that I do it in the classes that I offer every Thursday. I'm going to give all of you, not only Ms. Rideout, but all of you, my email and my cell number. My name is Ivani Torres, Torres, and the email is just like that, ivan.torres@dc.gov, ivan.torres@dc.gov. My cell number, this is a cell paid by the citizens like me, the residents of the District of Columbia, so you should have it. If you have, you know, further questions, 202-641-3065, 202-641-3065. You can always reach out to Ms. Rideout. She has the express lane. She has the express lane with us because she is just wonderful, you know, and the ways that this is all, you know, being put. So if you have a need for additional information printed in other languages, so you cannot find what you were looking in the website, reach out to her, reach out to me, whatever makes you, you know, makes you comfortable, and we will be glad to address them. So in response to this question, you know, from Ms. Hunter, this is the way to do it without any hesitation. Just contact us. The next question, I know we are in the 45-minute, you know, point. What is the active time frame of the virus once contracted, doctor?
Okay, I'm not entirely certain exactly what this question is asking, but possibly one thing I can say is that kind of a timeline. So you are when you are exposed to coronavirus, you can develop symptoms within usually from 2 to 14 days. So that's why like the quarantine period, if you get exposed, is 14 days, because by 14 days you should have got sick if you had coronavirus. So and also people are contagious and can spread to others for 2 days before they develop symptoms. So it's kind of like, so I would say in general, the active time frame, that's kind of what it is. So 2 days before you show symptoms, you're contagious. And then if you're exposed, you usually will get sick within 2 to 14 days. As I mentioned earlier, active time frame. So some people, as I mentioned earlier, who are immunocompromised, can shed the virus for longer. And so that's actually a more complicated question, that part. That can be up to 20 days or possibly even longer. A lot is still not known or figured out for certain with the coronavirus, but that's like our best information right now.
It is indeed. The next question that we have is very important too, and I think very important now, and it's going to be even more important in the weeks to come. You know, what will be the new normal, quote unquote? What will it look like as we transition out of COVID pre-vaccine and post-vaccine? I venture to say, I come from the school of Dr. Nesbitt, who is our director, and I also come from the school of our mayor in terms of reality check, reality check, reality check. We should always stay hopeful. We should always stay joyful and very indeed in a positive mode and mood, both things, of how we are addressing this. We should be satisfied with the accomplishments, but we should also be extremely vigilant of the challenges that lay ahead. There is no magic kingdom that we're walking to the magic kingdom and we're going to get there by the end of the month, by the end of next month, by the end of the year. Because even if a vaccine is developed, successfully, and we know in our hearts, and science will speak through Dr. Sommers' mouth, but in terms of the reality check that we in policy-making positions are, we know that even if that vaccine that will be developed eventually proves successful, the distribution of the vaccine, the accessibility to the vaccine, all those things are going to be considered. So that new normal is not going to be click, we got found a vaccine, we successfully completed this phase of the trials, we are going to make it available, off we go to the races again. That's not going to be the case. And there is something very important that we have to consider. Even on flu vaccination, we don't have all the compliance, all the enrollment, all the involvement that we wish we had. By the way, we're already in flu season. We're already in flu season. Please take your flu vaccine. And if you have any signs that you can download, even on this website of coronavirus, make sure that people get access to the flu season. But I'm digressing. The important thing is that we know that there's going to be some hesitancy, that some people are going to say, this was approved in the way that I don't trust. So all those things need to be considered. All those things, science is the important thing. And we have to allow the scientists and people like Dr. Sommers and others that will sit down, crunch numbers, see realities, and sit down with the director and then in turn with the mayor who makes the policy decisions, but made on the science that she and others in her team put together. So that's going to be a big challenge. And I'm sure Dr. Sommers shared that view with me.
Yes. I agree. There's a lot in between us and the new normal of when that's going to be. And, I don't have a crystal ball. I can't say exactly when life will be normal, so-called normal again. But, they are hard at work on vaccines. Obviously, that's a giant priority in the country. There's a lot of, and worldwide, to try to create a good vaccine. And our public health officials, at the national level have assured us that the process will be done properly and following science. So I certainly hope and expect that will happen. But it's from the best I've heard, a vaccine. I mean, I heard Dr. Fauci giving an interview a few days ago, And, you know, I trust what he says a lot. And he seems to be saying that we won't really expect a vaccine until like maybe summer next year. So like middle of next year. And as Ivan pointed out, when there is a vaccine, it's not like, okay, now we're just going to give it to everyone. It's going to be a long process of like prioritizing groups that need it first, such as like healthcare workers or, you know, people in nursing homes. And so by the time the average person out there gets a vaccine, that could really be some time. So I would encourage all of you though to stay hopeful, follow the guidance of the public health officials, and you know, be prepared that we might be doing this modified behaviors for some time to come. You know, I would expect through most of 2020 at least that we're going to still need to keep all these principles in mind and learn them well and practice them.
There is a last question on the written submitted ones. I don't know if there are any others, so I'm gonna, you know, try to rush to comply, you know, and respect everybody's timing. It says, how do you do your best with limited resources? That's a very realistic thing. And the example is affordable housing co-ops, and we have in the district that can afford to pay for daily cleaning. So I'm gonna discuss this question, you know, further internally, and even I'm gonna venture to say that I'm gonna discuss it with others within the mayor's office, and talk about it, because I have seen other initiatives that do help, you know, other situations, and this is an area that's frankly I have never thought about. Maybe they have. And I give you my word that I'm going to pass this along in person. I'm not just going to send an email and forward it. Yes, I will forward it, but I will follow it up with a discussion. I'm heading back to Washington process right away today, and I'm heading back to Washington on Monday. And specific answer this question that I think it might be in the minds of many more. Are there any other questions that might have come up in the queue, or that we missed here, or something else?
So far, there are no questions in the Q&A chat.
Okay.
For our participants on the line now, if you would like to submit a question, please go ahead and do so while we have Dr. Sommers and Mr. Torres on the line. We would love to take your questions that have arisen during this event.
In the meantime, I would like to remind everyone that this is a partnership. We're beginning, you know, a good, you know, work of partnership, and hopefully trust will be built based on performance. We want you to see us, the Department of Health, as not only the resource for good, sound, science-based information, but also for a compassionate and caring approach to all problems, like the one that we just talked about. This is difficult. There are intrinsics that, you know, are extremely challenging. I'm going to just mention one to give you an example to make you aware of how aware we are, you know, we're in. In those cases that I mentioned that are in the website, in those areas that I mentioned, Upper 16th and Columbia Heights, we have issues with congregate housing. And in the forum that I am, I don't think I need to, you know, explain the concept of congregate housing. But we also have to see the unique cultural situation that is behind these issues. When we go there, it's not just about going to a house where 7 people live, which might be blood related or non-blood related. You know, we are facing a city that has high cost of living, of renting or spending, and then we have to deal with that challenge in a unique, that is not only linguistically competent, but that offers that cultural competence in order to solve it. The department is equipped to do that. The department is willing to do that. And we want to partner with you. People like Dr. Sommers want to put her science background, her amazing professional, you know, sheet of service and education, you know, put it to service to all of you. because in the end, what you are doing is what we are also doing. We have the same concerns. I cannot tell you how proud I am, and I know Dr. Sommers joins me in this, to be with you with this specific group, and for Ms. Rideout to be so kind and so patient to reach out to us and follow up with us. This is the kind that I don't forget.
Thank you so much. Yes, we no longer have any more questions in the chat. And I just want to take this opportunity again to thank you so very much to Dr. Kimberly Sommers, Mr. Ivani Torres for their time and their expertise, lending their expertise to us, the folks who have joined us today. Our membership is made up of over 180 nonprofits, affordable housing developers, business owners, and local advocates. And of course, this is an issue pervading our community and world today. And we just wanted to provide an opportunity to help each other remain safe and healthy. And so again, we appreciate your time. We will be forwarding this presentation and all of the materials and Mr. Torres's contact information. He so generously gave out. Again, that is Ivan, IVAN.Torres, TORRES, at dc.gov. He gave his phone number, 202-641-3065. And we also encourage you to visit daily the coronavirus.dc.gov to stay up to date on the latest health information. So once again, we thank you so much for your time. Thank you for joining us all today.
Yeah.
Thank you.
Thank you.
Big heart from Puerto Rico.
Bye-bye.
Thank you.